Hello, my name is Aaron Ng, and today I'll be discussing pneumonia, presenting for anatomy. In this presentation, I'll discuss what pneumonia is, the causes and populations most at risk, how it affects the anatomy and physiology of the lungs, and the current approaches to diagnosis, treatment, and the role of AI in patient care. So, what is pneumonia? Basically, it's a common lung infection that causes inflammation in the air sacs or the alveoli in one or both of the lungs. These air sacs could fill with fluid or pus, making it harder for oxygen to move throughout the bloodstream and causing symptoms like cough, fever, chest discomfort, and shortness of breath. Pneumonia can affect people of all ages and ranges in severity from mild illness to life-threatening disease, particularly in young children, older adults, and individuals with weakened immune systems. Etiology. Microorganisms such as bacteria, viruses, and fungi can enter the lungs through breathing in infected droplets in the air. Normally, the body protects itself using nose filtration, mucus that traps germs, coughing, and the immune system, which usually prevent infection. Pneumonia develops when these defenses are weakened, when large amounts of germs are inhaled, and when the germs are strong enough to overcome the body's defenses. Infections can affect the upper airway, the bronchi, and the alveoli. When the alveoli become infected and filled with fluid, it leads to pneumonia. Who's at risk for pneumonia? Anyone can get pneumonia, however, the following groups are at a higher risk. Adults, ages 65 and older, children younger than age 2, people with certain medical conditions, smokers. Pneumonia disproportionately affects young children, older adults, and immunocompromised individuals. It is the leading cause of death worldwide in children under 5, causing about 16% of deaths in this age group. In the U.S., number one reason children are hospitalized, around 1 million adult hospitalizations occur yearly, and about 50,000 deaths toll annually. Older adults have the highest risk for severe disease and death. Now let's discuss the public health impact. Pneumonia is a major cause of sepsis and septic shock, taking around 50% of cases. Hospital-acquired pneumonia is one of the highest mortality rates among hospital infections. Survivors may experience long-term health effects, including reduced lung function and decreased quality of life. Pneumonia places a large burden on healthcare systems, costing billions of dollars annually. Those are greater risk for bacterial infections and pneumonia include people recovering from surgery, people with chronic respiratory diseases or viral infection, children younger than 5, older adults, and people who have weakened immune systems. The most common type of bacterial pneumonia is pneumococcal pneumonia. How pneumonia affects the body. First, infection primarily targets the alveoli, where oxygen enters the blood. Alveoli become filled with fluid, white blood cells, and microorganisms. It may involve small lung patches or enter lung lobes, lobar pneumonia. And how it works. Infection hits, the germs enter the lungs and start to multiply rapidly. Inflammation begins. Your immune system sends white blood cells to fight back, causing lung tissue to become red and swollen. Oxygen blockage, because the air sacs are now filled with liquid, oxygen cannot pass through your bloodstream effectively. The result is your body works harder to breathe, leading to shortness of breath, increased work of breathing, coughing to clear fluid, and a faster heart rate to move what little oxygen you have. Diagnosis. To get a proper diagnosis of pneumonia, you may need a physical exam, listening to the lungs for unusual crackling sounds, chest x-ray, which shows infection and inflammation of the lungs, oxygen or saturation test to check how much oxygen is in the blood, a sputum sample or mucus test identifies the germ causing the infection, arterial blood gas or blood tests, which may check for infection and whether it is spread into the blood. And based on symptoms, physical exam, chest imaging, and laboratory testing, you may have one of the classifications below, such as community-acquired pneumonia, hospital-acquired pneumonia, and ventilator-associated pneumonia. Treatment of pneumonia. For antimicrobial therapy, bacterial pneumonia, you can be treated with antibiotics such as macrolides, beta-lactams, fluoroquinolones, depending on severity and setting. Viral pneumonia, you will use or typically see supportive care such as antivirals for the use of spread of influenza and other identified viruses, and fungal pneumonia may require antifungal medications, often in immunocompromised patients. Supportive care may include hydration, which helps the respiratory secretions and prevents dehydration. Fever and pain control. Acetaminophen or NSAIDs reduce fever and discomfort. Cough management helps clear airway secretions while maintaining airway patency and protection. Respiratory therapy, incentive spirometry, airway clearance techniques, and breathing exercises improve ventilation. Oxygen and advanced respiratory support, such as supplemental oxygen. You give oxygen when saturation is low to maintain adequate tissue oxygenation. High-flow nasal cannula or oxygen, such as non-invasive ventilations like BiPAP and CPAP, used if respiratory distress worsens. Mechanical ventilation is required in severe cases with respiratory failure. Hospital-based management for severe pneumonia, IV antibiotics and fluid, monitoring for complications such as sepsis, pleural effusion, or septic shock, and ICU care when severe respiratory compromise or organ dysfunction occurs. Artificial intelligence in pneumonia care. So AI imaging analysis detects pneumonia patterns on chest x-rays and CT scans faster and sometimes earlier than a manual review. There's risk prediction tools that help identify patients at risk for severe disease or ICU admission. Clinical decision-making support helps guide antibiotic selection and treatment timing, and monitoring systems track patient and vital signs to detect deterioration early. These are my references. Thank you for watching my presentation. If you have any questions about pneumonia or anything regarding respiratory therapy, don't hesitate to ask me in class. Thanks.